that gets us then to the item number 93, which is the COVID-19 briefing. Manager.
Mayor, council members, and to our community, I mean, we have been experiencing an unprecedented time for not only our city, our state, our country, the world, and we have been committed at the city and local level to do everything that we can proactively to respond to this pandemic. What we have for you today is a briefing that will involve Dr. Escott, our health authority, Director Hayden from our public health department, Juan Ortiz, the Director of Homeland Security and Emergency Management, and Veronica Briseño and John Hawkinios from our economic development areas. We will be having each of them come up and do a brief overview of the work that has been going on, because I really want to have the bulk of our time today to answer your questions. So again, we appreciate all the support that we have been given, and please know that your staff has been working day in and day out to make sure that we keep our community safe and make sure we keep our own employees safe. So thank you for your continued support and guidance in that respect. With that, I'm going to ask Dr. Escott to give an overview of how things are looking from his perspective.
Thank you, Spencer, Mayor, Council. I'm Dr. Mark Escott. I'm the Interim Health Authority for Austin Public Health. As you're all aware, the situation has grown worse and worse by day. Just today, the City of New York has added multiple trailers outside of hospitals for anticipated need for makeshift morgues. Austin's not immune. Texas is not immune. Communities across this country are not immune from this. But the early and decisive action that the mayor and council and the county judge have taken have bought us substantial time to prepare, to get more equipment in, to make more plans so that we can face this more effectively than other communities. Texas, as of today, has 1,424 confirmed cases of COVID-19 with 100 individuals hospitalized. Just today, during this council session, the governor has mandated the quarantine of individuals returning to the state of Texas from New York and New Jersey into a 14-day quarantine. Here in the city of Austin and Travis County, we have a total of 119 cases, which are confirmed. That information is on our website. Today, we also added a dashboard for the community to provide updated statistics, including distribution of age, as well as a number of other factors. And we will continue to modify that and update it so that we can provide useful information, as much transparency as we can throughout this crisis. We also intend to add some features on there which will indicate the number of individuals hospitalized, the number of individuals in ICU settings, and already on there is information on deaths, which are 0, as well as recoveries. As you all saw earlier today, we have been successful in partnering with not only city and county and surrounding jurisdictions, but with our healthcare agencies, our hospital healthcare systems, and the University of Texas, who today released their modeling for the pandemic, at least over the next several months, for the city of Austin and the Austin MSA. That modeling shows very clearly the impact and the importance of social distancing. We're at 50% approximately through our early action for closing bars and restaurants and ending special events. You can see visually from that graph the importance of getting beyond 75%, which we hope to do through this effort at Stay Home and Work Safe. We really need to try to get to 90%. We need to try to buy as much time as possible so that we can secure enough supplies of personal protective equipment for our healthcare workers and our first responders, so that we can identify successful options for treatment of those individuals who are suffering from COVID-19, and so that we can further enhance our testing capabilities so that we have a better idea of how we're doing and where we are. On the note of testing, we have been successful at creating drive-through testing. We have actually been doing some element of drive-through testing for the past month and a half with our partnerships with our healthcare systems. We now have community-based testing sites. We have a common platform which can be used by physicians and other clinicians in Travis County, Bastrop County, Williamson County, and other surrounding counties that can enter patients into this system. We prioritize them and we assign them locations where they can show up to get tested. We now have the capacity to have a testing site for public, a testing site for healthcare workers, and testing site for our first responders and critical infrastructure members so that we can ensure that testing can be done in a timely fashion. We are still somewhat limited by the test collection kits. If you remember early on, there was an issue with the reagent and the ability to run the tests. Now we're short on swabs and the what we call the viral transport media that it goes in. But we're working to secure additional resources so that we can continue to enhance our ability to test folks so that we can make better decisions regarding how to proceed after this initial stay home and work safe initiative. We have been actively involved in our partnerships with our healthcare entities, our hospital CEOs, our medical school friends, our first responders, and local government from around the jurisdiction. We have created a number of task forces to look at particular things like nursing homes. How can we further enhance our capabilities at protecting our most vulnerable populations? We have task forces associated with addressing in-hospital surge. How do we create more beds? How many more ventilators can we get? How many do we have right now if we collect those into those healthcare centers? And also looking at alternate healthcare sites. These may be places that used to be hospitals, maybe current hospitals that may have only done elective surgical procedures that now have additional capacity because those elective procedures are not happening, as well as other non-traditional sites like hotels in large spaces that may be converted to care for individuals if we do experience a substantial surge beyond the capacity of the healthcare system. We are increasing our ability to respond to this. Our hospital capacity right now looks good. We're about 50% capacity in our hospitals across the system right now, which is exactly where we want to be as we wait to see what happens over the next 2.5 weeks. Once we have that information, once we have that data, once we have more data to plug into the modeling, it will help us better predict what the next several months look like. As I said earlier this week at a press conference, our unanimous opinion of our expert panel was that schools should stay closed for the remainder of the semester and possibly through the end of the summer. This is a basic assumption of the modeling that you may have seen earlier today. Because of the number of interactions that school students have with one another every single day, getting effective control of the spread of this disease is just not possible if schools are in session, at least in the traditional sense. We are also working hard at creating opportunities for people to stay in alternate sites like hotels if they have COVID-19, if they don't have a home to go to, or if their home is not suitable for self-isolation at home, if they don't have their own room, or the circumstance that they have someone in their home who may be at high risk for complications. We want to be able to offer those individuals an opportunity to stay somewhere else where they can isolate effectively and we can prevent transmission within the home, which, as you may recall, was a significant factor in the spread in Wuhan and China early on. That concludes my report. I'm happy to take questions.
Mayor? Thank you, and let me just express my thanks from all of us and from the community. We really appreciate the work that you and your team are doing. I wanted to ask about testing. I wanted to ask if you could just speak to, I think there's just a common question that people have, and that is, why can't we test everyone? And so I know you've spoken to that at press conferences, but I think this is a briefing, and I would think it would be helpful for people to understand. So I have that question, if you could speak to that, which to my mind speaks to the availability of the test, if I'm understanding correctly. And so my question, is that a matter of supply? Is it a matter of us paying for the supply? Where is the breakdown in terms of the number of tests that are available?
Unfortunately, money is not the issue. It's the supply chain that's the issue. We have a number of companies that are working hard to produce more of the swabs and the viral media. We're identifying other options that may be used, other kinds of swabs, other kinds of transport media which can be used to do these tests. The reason why we can't test everybody is because of that factor. We have enough lab capacity now through the national labs to test many people. However, it's not a quick test. Mm-hmm. I've had my own family members who have been tested recently, and the turnaround time has been 6 days for first responders. While this is important for tracking, when we have to make decisions like who needs an isolation room or not in a hospital, if it's clearing them because we need a healthcare worker or a first responder to go back to work, 6 or 7 days is not good enough. Mm-hmm. We do have some promise. Over the weekend, the FDA approved, through emergency use authorization, a point-of-care test, which right now can be done in hospitals and is rolling out primarily right now to those that are hardest hit, but we expect more broadly across the country in the coming month, that has a 45-minute turnaround time. That's the kind of testing that we need so that we can test people, we can know relatively instantly if we need to isolate them or not, or if they can return to work or not. So that's the big issue right now. We've had to prioritize those in the hospital, our healthcare workers, our first responders, to ensure that we could make good decisions about them, return to work or not, or isolation bed or not. Less of a priority has been the young and healthy person that we expect is not going to have a complicated course. We want to test everybody. In some circumstances, we don't have to test everybody because the instructions are the same. If you have a flu-like illness, you must stay home for at least 7 days or at least 3 days after the conclusion of your fever and improvement of symptoms, whichever one is longer. So this is the instructions that folks have been getting along the way if we haven't been able to test them. Our hope is that over the next week that we'll be able to test anybody who is entered by the clinician into this testing pool.
Okay, just as one follow-up, then others may have questions. But the related question is, and I'm just repeating what people have asked me, which I think is important to ask, is that people don't understand. I think there's people are not understanding why this is happening in the United States, for example. And I understand these are just news stories and they may be missing information, but there are stories, for example, of at least one other city in Italy and also another city in the United States where everyone is being tested. So is that just a matter of the fact that they're able to get their hands on those tests, or is there something else going on?
No, it is a matter of the ability to get their hands on the test.
Okay.
It's right now in the United States, because those supplies are limited, they are being focused on Seattle, New York, New Jersey, and those that are most hit. The private labs are doing a good job of expanding the capability of running the test, as well as increasing the timeliness of the results, but we simply don't have enough test kits to run right now. We have requested a week ago from one supplier 100 additional sets of swabs. Mm-hmm. We still don't have those.
Okay.
We do have some supplies from the federal government, which arrived last week with no timeline for replenishment of those supplies. So we're still in the phase right now of trying to make sure that we have enough in a week to still run healthcare workers and first responders and those at high risk of complications. I'll also say, council member, that we expect this for younger people to be a relatively mild course. As the numbers of cases increase, there are going to be deaths. There are going to be substantial illness. There are going to be people on ventilators who are younger. It's just a matter of statistics. But we still are at the phase right now where we have to prioritize those tests where we need it the most.
Thank you.
Councilor Poole.
I wanted to ask a little bit, I'm over here.
Oh, sorry.
Thanks, Dr. Escott. I wanted to ask a little bit about the respirators. I was watching Governor Cuomo up in New York, who has been doing some press conferences and stuff, and he talked about the stockpile of respirators that evidently the federal government controls. They're holding on to them, and they were, I don't know what the criteria would be for their distribution, but evidently there was going to be some kind of a, well, California will get this many, and New York will get this many, and maybe we'll send some down to Florida. And Cuomo's point was, well, the actual epicenter of this pandemic is in New York right now, and we need them all. And because of the way the virus works, hopefully they can get through that spike in New York. And then he said he would pay to send them to whichever location next needed them, be it Washington State or California. Do you have any information for us with regard to the respirators and the stockpile that's evidently being guarded assiduously?
Yes, and this is why I spoke earlier this week about the importance of a national strategy and a national plan, a national response right now because of this exact factor. Because we don't have enough supplies if everybody's on fire at the same time. We do have enough supplies if there's a few hot spots. We should be flooding those hot spots with supplies and people like we would in a battle, in a war, because that's what we're in right now. And when that battle settles down, we move those supplies to other places. That's the correct strategy. That's not what we're doing right now. We have received some what we call SNS, Strategic National Stockpile of PPE. It's not enough. Many of it expired in 2007, but it's better than not having anything. So we've got folks going through the warehouses looking to see if it still works. If the elastic is broken or degraded, we may have to start stapling rubber bands on the backs. That's where the stage we're all right now. Because that's where we are right now, it does not make sense to not have a national response to this effort. That's what we need now. We need to buy ourselves time. We need to settle down this epidemic so that we can create better battle plans, better ability to respond, because this is not going to go away in a month or 4 months. This is going to be an issue for the next year at least, and we have to have a strategy that's going to work over that time period.
So is there anything that we can do here in order to encourage that policy making? I realize we are just a tiny little municipality far away from D.C., but I think that there are a lot of voices that have been raised along this same line.
Well, I think what we're seeing right now is major cities being affected. And for some people, they think, oh, this is a city problem. This is a city problem right now. And this is the way I like to explain it. There are jurisdictions that know they have cases. There's jurisdictions that have cases and they don't know it. And there's jurisdictions that are going to have cases. This spreads twice as easily as the flu as far as we know right now. So if you had flu in your community, you're going to have this, except this is going to be worse. This is going to be more impactful. So this is not a big city thing. It may be a big city thing now. In a week and 2 weeks, it's going to be a whole country thing.
So can I take as a takeaway from that you think that the simple weight of reality will come to bear, and maybe then the adults in the room in Washington will make the right decisions and get some kind of a strategy in place? In a hopeful way?
Let me say this because it's important to frame it. There have been some good decisions made in Washington early on. There was a good decision to make the travel restriction for China and the other countries affected as it went along. But we've got to continue to make good decisions. It's not going to stop. We're not going to turn things back on by Easter. We need to think about the impact through next Easter. Because if we look at pandemics, if we look at 1918, 1919, the same exact thing happened. Things settled down over the summer. We're not sure if it's going to happen with this. It settled down over the summer, and then it came back in the fall. And we have to understand that that's the nature of virus, that's the nature of disease. We need to delay this as long as we can so that we can identify effective treatments and at some stage a vaccine so that we can get a better handle on this.
Thanks.
You bet.
Councilmember Harper Madison. You're unmuted. I think you have to unmute your microphone. You're good.
I didn't want y'all to hear what homeschool sounds like. I had a couple of questions. I'd first of all like to say thank you to everybody for doing our part to flatten the curve and be doing this from our living rooms. I know that it's a whole new world and there's a lot for us to all adjust to. And so I appreciate everybody's commitment. And then to Dr. Escott, there's a couple things. One, wow, what a job you have. So there are two things that seem to be inundating our office right now, one of which I think you might be able to help us point folks in the right direction. So there are a lot of people who are interested in manufacturing masks. And we all recognize that some of those are more effective than others. And so I'm very curious in a lot of ways, I think, how to direct the efforts of folks who really just want to make a contribution to what you described as the battle and help us win the war, not do more harm than good. Just curious about where you stand in those regards. I know I've seen a couple of different outlets that were asking folks to take the opportunity to make masks at home. And just what I've heard on the other end is that doesn't necessarily always produce masks that people can use. So just any contribution there would be helpful. And then I have one other question after that.
Sure, that's a great question. We've certainly received lots of outreach, both from private citizens as well as industry locally, who are willing to enter this war effort to change what they're manufacturing to help this effort. And I think this is an example of the resiliency and the community that we have here that want to come together and work together to really address this as best as we can. I'll say that we have a personal protective equipment task force that is evaluating these types of things, looking at different designs for masks. And I'll make sure that Juan Ortiz, who's speaking after me, connects y'all's offices with the right person to address those particular questions.
Yeah, I'd say it maybe doesn't necessarily seem like it, but it is a point of priority for our office. You would be amazed at how many folks are trying to contribute in whatever way they see fit and can. And Austin just happens to be the kind of creative city where we have a lot of bakers who don't happen to be working right now. And so they're trying to contribute what they can. I just want to make certain that we take the opportunity. I appreciate knowing that there's a task force and I can maybe take it to them, but I want to make certain that we take the opportunity to combine all these separate efforts and have a quarterback of sorts, like one-stop shop where folks know to go, and then subsequently what's the protocol, and say thanks but no thanks, but folks really can't use these masks, so let's use your time and effort elsewhere. It really is a big point of concern for us. Then the other thing I was going to ask was, and I don't know if this is directed at you, unless of course you have some insight based on your experience, we would need a full-time employee to be able to field all the questions we're receiving about how people can help. We have this organization, how can we help? I've got this idea about this initiative, how can we help? We want to do this thing, but now that there's the shelter in place, we don't know that we can help. I'm just curious if you have any ideas on how we can harness the power of all those people who really want to contribute, but not take away from the other work that our offices should be continuing to do outside of that, real concerted effort.
I'll ask you to hold that question for Stephanie Hayden or Juan Ortiz. They're going to give you a better answer than I will on that. We do have phone lines. We do have points of contact for that. We do have amazing volunteers from the Travis County Medical Society who are helping us answer clinical calls. We do have a lot of people volunteering to help us out. I'll tell you that Austin Public Health has never been so large as it is today, because we have so many departments and so many healthcare workers and others who are engaged in this battle with us, and that's been extremely helpful. So I'll defer to them.
Thank you.
Thank you.
Thank you. Doctor, I want to give visibility to this chart again, which came from the University of Texas, and I know you just spoke to this, and I want to thank the University of Texas for getting us this for Dr. Myers. As it turns out, kind of serendipitously, the person who is doing the pandemic modeling for the United States happens to be a professor at the University of Texas. And what that's meant is we've had someone here in our own backyard that's been able to do some modeling for us. And I want to thank her, and I want to thank Dean Johnston, Dean of the Medical School, for the work they're doing in advising you, and then you then take that to me and to the county judge and to the staff and everybody else that's involved. But there are two charts I just want to make sure that people watching this have a chance to see. This is part of the University of Texas presentation. It's online. You can see their entire press conference this afternoon, and I would suggest people see it. But what this shows us is the amount of control that we as a community have over what it is that we're going to face. And there's a tremendous amount, I think, of both hope and opportunity in that. But I'm going to ask you about this in just a second. But what this shows, I wish I could, but they tell me that with the technology they can't do that. It would shut everything down. It's posted. We'll get it online. It's in a couple different places. I don't know what else to do other than, I don't know if the camera can get closer on this or not.
We could also take a picture of it and put it up on social media. Like we could take pictures right here and put it
right.
up.
That's okay. If my staff could get these documents up on social media, I think these are... can you put it up as the backdrop? If it's hard, I don't want to waste a lot of time on this. We can't lose that. Let's just stay here. At this point, we put this on so many different places online. The city did a press conference. It's going to be on the city website. The University of Texas did a press conference. It's there. If I can get people curious enough to look for this, that they'll actually go hunt and find this, I will consider it an achievement. But what it shows us is that by getting to 50%, where we are right now, which is great, in short order, even at 50%, that's just decreasing daily interactions that we have with people by 50%, which is about where we are right now. And if we maintain that, we're almost 15 to 18,000 hospital beds underwater in the next month and a half, if that long. Which means we're going to have to find 15,000 places for hospital beds in this city, not to mention how that taxes and strains all of the healthcare system. That's what we're trying to avoid, and that's at the 50% that we're at right now. But if we can get to 90%, then we're going to be able to handle all of this within our existing capacity. If everybody can go to sleep tonight and think, how many people did I interact with today, physically interact with today, and count the number of people over the course of the day. And every day when you go to sleep, think that through. And to try to drive down to 10% of what you used to do. That's what we're trying to get people to do. Because we control this. The other chart in the University of Texas and Dr. Myers had more than just these two. But this is a serious one because this one reflects mortality in our city. And what this says is that at 50%, where we are right now, we're looking in this community at potentially having over 6,000 people die of this virus, which is a staggering number. We're talking about six-figure numbers across the country of lives that are going to be lost. But again, we have control over this. If you get to 90%, if we can decrease by 90%, we're only talking about very few people, relatively speaking, and we get to control that. But what that means is that the people that I saw at Barton Springs Pool, in the free end of that, shouldn't be there with a group of people. The people that I drive through town and I see playing basketball shouldn't be doing that, because we have to decide as a community how important those lives are to us. Because now we get to make the choice and the decision about what it is that we want to do, what it is that we value most in this community. And it is everybody's individual decision added together that will determine what we're able to do as a community. There is great power in that we control this, but we get to decide.
Yes,
I'm going to
Mayor.
ask for some other questions about this chart, and then at the end of questions about these charts, then I have one last question for you. Councilmember Kitchen.
Just about the chart. So when we're referencing the percentage, when you say 50% and 90%, you're talking about the level of social distancing we have maintained. And if I'm understanding correctly, right now, we think we have maintained 50%.
Just prior to entering the shelter, stay home, work safe ordinance.
Was
orders.
50%. And at 50%, we're estimating 6,000 deaths in the city of Austin.
6,000 people potentially dying before the summer's over.
Okay. So when we say 90%, that's our goal. So we can reduce those number of deaths, which I think you said to almost none.
Well, there'll be some, but it'll be very few.
All right, thank you.
Doctor?
Yeah, so we're not going to be able to avoid all deaths.
Okay.
What we want to avoid is excess deaths because we've exceeded our ability to care for people. And let me point out that what you're seeing here is just COVID-19 related deaths. Mm-hmm. If we far exceed our capacity of our healthcare system, people having strokes or heart attacks or pneumonia not related to COVID-19, they're going to have increased deaths also. This has the potential to touch every family in this jurisdiction. And we've not faced something like this in 102 years. What we are working on now is if we can delay this, it gives us the opportunity to look with everyone else at what kind of policies we can put into place so that we can open the window some more and do it safely. Can we further protect nursing homes? Can we further protect hospitals? Can we implement other types of policy that will allow us to return to operations more normal than they are now without putting us in danger? We can continue to have cases. We're going to continue to have cases. But we want to make sure that we never surpass the surge capabilities of our current hospitals.
So there have been a lot of conversation. Councilmember Tovo, you're on mute.
Thank you, Mayor.
Questions about the charts.
Dr. Escott, yes, thank you, Dr. Escott, for your tremendous work. And as you pointed out, Austin was proactive in many ways, and I just want to commend you and our public health staff and our mayor and our county judge for taking such strong leadership action. Mayor, you touched on the images that circulated pretty widely about Barton Springs. And Dr. Escott, I appreciate your real directness in helping our community be aware that if we continue on the trajectory we're on, we will have an overwhelmed healthcare system. And so, we've also received feedback from people about trails and the extent to which people are flocking to some of the trails in our community, some of the parks, getting on benches or getting on playground equipment. And so I wondered if you could just, number one, again, emphasize that we really must reduce our interactions down by 90%, and that when we're in those public spaces, if people are out getting exercise and in those public spaces, how important it is to maintain that appropriate distance. But two, you touched on this in your presentation, and I appreciate you doing so. You are, and I want you to confirm if you would, the healthcare community is working in a collaborative, coordinated fashion to address the need for more PPEs, the possible need and planning for a possibility that we would need additional spaces, that you are working in collaboration with all of the partners who represent our medical community to really plan for those kinds of possibilities, both with regard to protective equipment as well as facilities and space.
Yeah, we are meeting every single day with our healthcare partners from Baylor Scott and White, from St. David's, from Ascension Seton, from Central Health, from the medical school. We actually have multiple meetings every day at multiple levels. So we have our emergency planners from all the healthcare systems working together with our emergency planners. We have the executives meeting with executives. We have different layers of people meeting to ensure that we are covering all the bases. We have collaboration from mental health. We have collaboration from homelessness. We have collaboration from primary care, from pediatrics. We are doing everything we can to make sure that we are engaging as many people as possible. And I'll say I am incredibly proud of this healthcare community. I'm incredibly proud of our Austin Public Health team and the community in general, because they really have reached out. And I think this is a great example of what we spoke really early on about, the need for an all-government, all-community effort at this. Austin and Travis County are doing an amazing job.
Okay. About the question about the chart, before I ask my last question, you want me to ask my last question?
Oh, go ahead.
Okay.
Dr. Escott,
with respect,
I had asked Dr. Escott if he would also just reemphasize public spaces, as you did.
Yes. So,
Thank you.
The way we need to think about this is anytime two people come together, there's a risk of transmission. We need to reduce that as much as possible. It doesn't matter if you're 60, it doesn't matter if you're 15 or 25. That risk is there. So what we're asking people to do, if they're going to go exercise, we want people to exercise. We don't want people to have diabetes and strokes and heart attacks. But when they do that, they need to do it 6 feet apart. They need not do it in groups of people. Exercising by yourself is fine. Maintaining that social distance is fine. We want people to do that. But they need to be smart about it.
Further questions about the charts? Councilmember Alter.
Thank you. So I wanted to ask about the chart shows the 75% and the 90%, and part of what I'm hearing from physicians that are writing in is that the steps that we took starting yesterday would only get us 75%. So can you explain sort of under what conditions we would go further in restrictions and what those restrictions might involve? When do we need to have a strict quarantine regime? I'm just trying to understand what gets us from 75% to 90% if what we did yesterday doesn't do that.
So certainly if we see that we're on a trajectory that's going to exceed our healthcare capacity, we're going to have to talk about stricter measures to do that. I think in Austin we have an engaged community. We have a community who understands what we're talking about, who can understand these graphs and the importance of their individual decisions. My hope is that we don't have to have officers on the street asking for identification and proof that you're an essential employee. I'm hoping that we can do that together because we may be in this for a long haul. We're not sure yet what kind of impact the summer months are going to have. We're not sure yet the timeline to identify an effective treatment. We're not sure of a timeline yet for vaccination. So we want to be in a position where we can do things which are reasonable so that the community can be engaged in part of the solution, because they are the ones that have the opportunity to downgrade this from a Category 5 down to a 1 or 2. We're not going to make it go away, but we can make it better if we can stretch those infections out over a much longer period of time than we've seen in other jurisdictions.
So then under what conditions would we go to a systematic stratified quarantine system for folks who have tested positive or who are sick, which I believe is part of the next step?
Yeah, so we're in the process of doing that right now. So we are injecting more than 100 people into our contact tracing. That's through Austin Public Health, through other city departments, county departments, our partners in other jurisdictions, as well as the University of Texas, so that we can track people down, do that contact tracing, put them in quarantine, and do that effectively. Those were some of the other policy things that I was alluding to earlier. If we can get control of that and monitor the strategies of other jurisdictions who are facing this, then we have an opportunity to open the window more so that we can be less restrictive on the general community and focus more tightly on those who are at risk for spreading.
So you would say that we're working towards implementing that, getting the pieces in place that we need to be able to do the more systematic quarantine?
Yes.
Okay.
So
thank you, and thank you for
what we're seeing in China right now is they're not back to business as usual. They've opened the window some to see what happens, to see if they have effective control. We're going to see different experiments of different policy and the effectiveness. So as we go along, we're going to learn from other jurisdictions what's working and what's not, so we can implement the right measures here.
Thank you. Mayor Pro Tem, ask your question. Go ahead.
I have a chart question, but since you mentioned China, is it correct that that's the only area that are seeing now a decline? Is that right?
There are a number of jurisdictions that have plateaued at least. China's one of them, South Korea, Taiwan, Singapore, have all implemented effective strategies. Okay. Some of those have involved strict quarantine. They've involved, aggressively taking people from homes and putting them into quarantine. We're looking for more reasonable measures so that we can isolate people if they don't have the capability of isolating themselves at home, offering them a hotel room or another space where they can convalesce, they can get better, and limit the risk of exposure to their family members.
Yeah, and so that's my concern, because I've seen that they have a different respect for civil rights in some of those countries, and were able to implement some very strict quarantines. And so I guess along the lines of what Councilmember Alter was asking, it seems like we need to be implementing as really strict as we can here, because we may not get to the point where we can implement the restrictions in those countries at this point. But my question about the chart was, it mentions the 5-county capacity of the 5 counties. I don't know how to. Isn't it true that those 5 counties, though, actually help more than 5 counties? So there are rural counties that are not included in those 5 counties that will be sending patients to one of those 5 counties. Is that right?
That's correct.
Okay, and so because of that, our governor not doing the statewide mandate, how does it affect these models? Because these models are based on what we're doing here and what these 5 counties are doing, and it doesn't take in and if we're getting closer to 75, that's good for us, but that doesn't take into account a 6th or 7th or 8th county that's not in any restrictions, because they don't have the hospitals in many of those counties, and so they will be sending patients as we are doing all that we can to stop the spread. They will be sending patients because, as you said, there's 3 categories. You have it, I forgot what the middle one was, or you're going to get it. It's going to come to your area. And it's going to come to parts of our state that don't have it right now. Those patients are going to get sent to our hospitals. The governor mentioned in the last press conference that I saw, listening to what it seemed like the national doctors. He said he was on a conference call, and certain doctors were on that conference call. I'm just curious, to what extent is he listening to you and listening to the people here in our state, showing us modeling like this?
I think the challenge is that everyone's concerned about the economic impact of statewide or national action. The challenge is that we have to learn from people who've fought this battle already. We have to learn from China. We have to learn from other jurisdictions within our country who are facing this battle, who are lining up morgues outside of hospitals. We have to learn that an individual jurisdiction strategy is not ideal. An individual state strategy is better, but not ideal. We need a national strategy because, as you alluded to, it's going to keep getting reintroduced if we do it one jurisdiction at a time. We're going to have fires burning out of control in multiple large U.S. cities, more so than we already have right now, and we're not going to be able to control it. It's a mistake to believe that rural America is not going to be touched. They're likely to be touched in a worse way than we are because they lack that healthcare capacity in their own jurisdictions. And when the hospitals are full here or Houston or Dallas or San Antonio, they're not going to accept transfers in from outside the jurisdiction. And that is going to disproportionately affect those in the rural community.
Okay, so is it fair to say that the lack of a state strategy at this point really is hindering our ability to recover from this effort?
I think it's important that we act as one state. Okay. We act as one country. We can do it as our own jurisdiction or our MSA or with our partners in Central Texas. It'll be much more effective if we do it as a whole state and a whole country.
Thank you.
Further questions for the doctor? Councilmember Kitchen?
I wanted to follow up on something Councilmember Tovo had said, and that is simply that are we considering closing down places like Barton Springs Pool? I don't want to put you on the spot with that, and maybe perhaps what I should say instead is I hope we are considering. I think that I hate to go to that extreme, but I have seen multiple pictures now on multiple occasions, and unless we end up really working with that area and informing people and enforcing, it is one of our gathering points that we are not seeing social distancing. So my request is simply that we take some steps and maybe we try some level of education or enforcement at that location first. But I think that what's happening there is has the risk to the whole city. So.
It's a great point, Councilmember Kitchens. I'm hopeful that when the community sees the graphs, they see the numbers today, they will take it more seriously than they have in the past. More than 50% of our cases are between the age of 20 and 39. They're the ones who are more likely to have a mild illness. They're the ones who are less likely to have a severe outcome. But because of the number of social interactions they have, they're the most likely individuals to spread. So we need their attention. We need their support. We need their compassion for other members of the community, their parents, their grandparents, to really drive their decision making.
In fact, the age group that has the most positives in our community right now are people 20 to 29, more than any other age group. I want to go to something that the Councilmember, one of my colleagues, spoke to in terms of the orders we have now and what percentage can they get us to, I think was one way to interpret the question. And I think the answer is that the orders that we have in place right now could get us to 90% if people would, in fact, get their physical interactions down by 90%. So the orders that were entered by the county judge and myself at your recommendation and the city managers and others had wanted people to stay at home. And the only people that shouldn't be staying at home are people that have a critical or essential need to be out. And we recognize when we do that there's grave financial hardship that results from that. But we're talking about thousands of lives. People shouldn't be trying to figure out how to fit within the exception. You know, we have finance as an exception, because people's credit cards still need to be able to work when they go to the grocery store. So those people need to go to work to make that happen. But that does not mean that a company that does that gets to do all the other things that the company wants to do, other than the reason why it is that they're on the list. And people should be looking at everything that they do and thinking about their neighbor and trying to decide, is this critical or is this essential? This is what I need to do. To that end, we've listed construction. And I'm getting a lot of emails and a lot of calls about that now. And it's certainly something that we have spoken about and continue to speak about. The professor at the university has offered perhaps to help us model what different restrictions mean or don't mean or the like. But so while you're here talking to the community, would you talk about construction activity?
Yeah, so, the challenge is that we do want people to, right now, for the remainder of the 3-week period, to really think of themselves as a Wuhan-style lockdown. We don't want to mandate that, but that's how we want them to think. We want them to think that when they go outside of their house right now, it should be essential. Because, as I said before, if they're interacting with other people, particularly within 6 feet, there's a risk of transmission. What we're in the process of doing right now is assessing over the next 3-week period, where are we going to be? How is that curve changing? Are we stabilizing? Are we decreasing the rate of transmission? Are we improving our doubling time? If we are, then we can look at opening the window a little bit, allowing for some aspects of the business community to return if we can do it in a safe way. Again, we are cognizant of the impact on our community. We're cognizant of the impact on jobs. We're cognizant of the impact on the ability to afford housing and health care. And we want to be as least restrictive as possible. But if we are not successful, we really have the potential of impacting every single family in this community. And that's why we have to make careful, deliberate decisions about how much to open windows to ensure that it's going to be as safe as possible.
Councilmember Harper Madison. Did you want to go?
Sorry about that. I was still muted. What I was going to say was, you made mention earlier of a test. You called it the point of care test. And I'm just curious why we don't have more access to those now. What's the difference between what it is that we're short? I think you said we were short on the other test. We're short swabs, viral media, transport media. But with this point of care test, it sounded like a different test. Is that the case? And if so, how do we get closer to getting more of those where we could get faster results?
It's a great question. That was just approved over the weekend by the FDA. So right now they're focusing those efforts on making sure those tests are available in those hard-hit areas. And then it's going to expand to other hospitals using that type of lab. And then we expect that we'll see growth outside of the lab or outside of the hospitals into outpatient settings. It takes time. Remember that we just identified this disease earlier this year, and it's quite remarkable that we already have mapped the genome and we have testing, and now we're already at point of care testing. Some of this testing we expect to increase rapidly, and this is another reason why delaying as long as possible puts us in a better position to handle this for the months to come.
I appreciate that. And then the last question that I had as a result of something you said was, you were talking about spaces for people to quarantine. Do we have an asset map that's established that we're in a good spot with spaces for people to go, or do we need more spaces?
We have some contracts for spaces, both hotel-type spaces as well as other spaces where we can put more open spaces. Our ideal situation at this stage, while we have relatively small numbers, is to, again, if it's not safe to isolate at home or they don't have the ability or they're afraid to isolate at home, is to put those people in hotel rooms so they can feel safe, they can ensure their family safety, and we can limit that person-to-person spread within a household, which was really a challenge in Wuhan.
I'm sorry. One last question, and this just occurred to me. So in a hotel setting, for example, you have to go through the lobby, you have to get on the elevator, you have to interact with stuff that the housekeepers would then otherwise take into the environment. I guess I'm just curious. You said that's ideal, but it sounds almost to me like what would be ideal is a single dwelling where a person could enter and exit without interacting with anybody else and truly isolate. And I say that to say, I was reading about how many people really got hit with Airbnb cancellations. And I'm just imagining how many fully furnished houses are sitting across the city of Austin right now where people could be quarantined if they don't have a space. And if that's a strategy that we're willing to sort of figure out how to manifest.
So those are great comments. We do have a team that identifies ideal hotels. Ideal hotels are ones that have an entrance from the outside with no common lobby. So there is a process for evaluating, making sure that it's safe for other people in the hotel. Primarily, we're using hotels that don't have other guests there, at least in the same area, because we don't want to have any risk of spread within a hotel type of setting with people who are not confirmed. And that's why we are looking at specific sites so that we can cluster people together who are known positives. We'll have other circumstances where we have people who are being tested that are not able to isolate themselves at home that we can put in another area so that we can ensure that it's as safe as possible while protecting the rest of the community.
Thank you.
Thank you. Let's go Councilmember Poole, Councilmember Kassar, and then let's go to Director Hayden so that she can ask some questions. Councilmember Poole?
I was getting some calls about construction. There are a number of projects going on in my district, and the answer that I got from staff was that the construction could continue as long as the members of the crew would stay at least 6 feet apart and disinfect any tools that they may be using that are shared tools. The nature, of course, of some of the construction is that you actually cannot do the work 6 feet apart. So this is sort of an advance notice, I guess, for the city manager and the mayor and for the team, for the COVID team, to look at some of the construction projects that are not, in fact, deemed to be essential construction projects. I have some of those in my district. I'd be happy to kind of work through a list with y'all on that, but I would like to see that we are more directive and emphatic, not only with our enforcement, but acknowledge the realities that construction mostly cannot be done 6 feet apart, or in those instances where it can't. I would just note that many of the workers on those crews are probably much more vulnerable than would the rest of us, and we have the ability to shelter in place, and so I want to care for them as well.
Yeah.
It makes these issues really hard because those workers are also the ones that are going to be least protected by what Congress just did. So we're taking the most susceptible part of our population. We're saying you can't go to work.
Completely understand.
They don't have that social safety net.
And so that has been, I think we all recognize that, but they will become ill too.
You point out accurately that we are in a world right now where we're choosing between two bad options every time we're given a choice.
And so I really do want to point to the physical health and safety of our community is our primary mission.
I agree. And let me just comment. I think it's important for us also to remember that this is an all community, all government effort. And for me, that means those of us who can still work, those of us who can telecommute to work, have a duty to support those who can't. And that means giving more than you normally do. That means sacrificing more than you normally have to sacrifice so that we can get through this together as a community. That means donating to churches and Salvation Army and Red Cross and groups who are going to support these folks who are most impacted, who are living day to day with their income. That's what a community means. That's what a community has to do in circumstances like this.
And to that end, there are conversations still ongoing about construction, about the construction that's happening, shouldn't happen, about what we could be doing on those sites or not doing on those sites, whether we could use those sites and those gatherings to reach communities we may not otherwise be able to reach, just everything. And that conversation, like so many, is happening every day. And what you last suggested to me, Doctor, was that in another 5 days, we'll know so much more than we know today. And we can continue to make these decisions again daily as if they were new, which is what we're doing daily. Okay, Councilmember Cassar, then Councilmember Page, and then Director Hayden, if you would come down.
Thank you, Dr. Escott, for everything. How well can we track the percentage reduction in social interactions to know where we are on the graph over time?
So on the press conference from UT, Dean Johnston displayed a couple of different sources for that kind of information using cell phone tracking, basically the proximity of cell phones together. In one of those graphs, it showed Texas as a whole is about 50%, I think. Travis County was 50%. So we're doing well compared to other jurisdictions, but that's not good enough. This data was through the 23rd, I believe, maybe the 22nd. So it'll be impressive for us to see what it looks like after the implementation, particularly after today and the display of the graphs, so that people can really understand what we're talking about. So that's primarily how they're doing it. Another method is looking at road traffic to see a percentage of reduction of road traffic. So we're trying to support the medical school in their wonderful efforts at modeling with as much information as we can to inform that model and help us look at particular issues like what happens if we were to turn construction back on to some extent. What would the impact be of other policy changes so that we can open that window a bit more, we can allow jobs to continue and business to continue, but do so in a way that doesn't stress our healthcare system.
And it can be a short answer yes here, if I understand this right, that if we get to that 90% reduction and keep that line down, you're not saying that we necessarily have to stay at a 90% reduction throughout the end of the year to keep it that way, because basically that 90% reduction buys us the time to do the more strategic response that you just talked back and forth with Councilmember Alterga.
Correct.
So the goal is to try to get all of that stuff in place over the course of the summer, for example, so that the window potentially can open up more afterwards without as much risk of thousands of deaths.
Correct. And I'll say that I'm not saying at this stage we have to commit to a summer at 90%. I'm saying that's what the model looks like today. But every single day that data goes in, and it's going to inform us of how we can change policy. And we're going to learn from other jurisdictions so that we can make policy better and be less impactful on jobs and the economy.
And I'm going to speak a little bit more to this in a minute when we talk about economic resiliency, but from the public health perspective, we have primarily, the folks that are deemed essential are oftentimes people doing working class jobs, overwhelmingly communities of color, overwhelmingly more of the people that don't have health insurance, lower income people that we need stocking shelves, or working class folks that we need taking care of kids. Can you talk? There's an inherent tension there, but from the public health side, how do you think about, and what would you advise us on grappling with that risk of the fact that the people that most need work because they most need income, because they're least likely to have access to other government benefits or to savings, and are most likely to be doing those low-wage jobs, are also the people that are potentially getting most exposed? Can you talk us through sort of the levels of risk, especially for those communities, and how we should be thinking about that tension?
Yeah, it's difficult to quantify the risk at this stage, again, because we don't have community-wide testing. So how much risk is there for somebody stocking a shelf? It's difficult to say. We know with some degree of certainty that the more face-to-face interactions that you have, the more likely you are to get this disease. It's difficult right now to quantify the impact, the long-term impact on jobs and health at this stage. But this is a worry of ours. It has been a worry of ours since the first discussions regarding South by Southwest. This is why we are looking for opportunities to refine policy as much as we can so that we can provide jobs and employment for those folks who are most impacted by this. I think this is part of what I would love to see as a state and national strategy is let's employ folks, but instead of doing what they normally do, we need people to make masks. We need people to make ventilators. We need people to make healthcare equipment. We need people in childcare to support those essential workers. There are lots of things that we need more now than we did 2 or 3 weeks ago. Let's refocus those efforts. Let's offer opportunities for those folks in those positions that we now have identified as areas of need. I think that will help at least get us through the short term of employment. I know that there are a number of companies who are hiring lots and lots of people. We have to make sure that we're connecting those who are out of work now with those that need work so that we can be as thoughtful and limit the impact on them as possible.
And that's the economic side that I want to get to. I guess maybe just as a takeaway is on the public health side, I imagine that there's a greater risk that we will have more outbreaks and more cases in places where you have more people that are doing work, that are still going to work, which I imagine are much more significantly going to be people that work with their hands or that are doing the kinds of jobs that require being there, right? You're not going to see outbreaks in communities where you're going to have more people that are accountants and data scientists compared to places where you're going to have more people that are stocking shelves or picking up trash, and that are doing the recycling or fixing water lines. And so if that's what we start to see, because that's where people work or that's where people are that may not have as much access to Twitter and knowing everything that's going on, I think we just need to be connected and make sure that we're taking extra care of those communities if that's where those are the people that are more at risk.
Absolutely. And the modeling we have that suggests that probably the majority of us in Austin Travis County will get this at some stage over the next year. So there's not a class that's going to be protected. It's going to affect us all to some extent, either personally or somebody in our family or a friend. It's not the same thing as Ebola or MERS or SARS in that there's a huge rate of critical illness if you get it. The real challenge is too many people getting it at one time. So it is important that we continue to support folks who don't have health insurance or who are underinsured. We have a number of volunteers in city services that do provide health care, city and county, to ensure that those who need care get it. Those who need testing will get it regardless of their ability to pay. So we are working hard, and we have an amazing healthcare workforce, an amazing physician workforce who's donating a lot of time to ensure that folks get the information, the care that they need, regardless of their ability to pay.
Councilmember Ellis.
Thank you so much, Dr. Escott, for being with us today. I know a lot of people are relying on you. I appreciate some of the comments that have taken place around construction. I have a gentleman in my district who is in the middle of some kitchen updates, and the contracting team understood the information coming from the city and halted what he was doing. So he's been kind of left in a gray zone of not having the right type of food prep space. And I wanted to know your thoughts on how we can strike a balance between allowing some construction projects to continue in the case of clean drinking water, plumbing updates, anything related to kitchen or baths, or if you have kind of any advice that you could give us about what we should be telling our constituents and where we need to speak with our city staff and legal experts to try to find that balance between making sure people can shelter in place and also protect people who are doing the difficult jobs with their hands that sometimes require them to be in tighter spaces. Can you speak to that a little bit?
Sure. We are right now. The message is we need to be as protective as possible, particularly over the next week to 2 weeks, so we can sort out where we are and what direction we're headed, up or down, as far as the rate of increase of the spread of the disease. Over that time period, we've got groups, law and public health and code, as well as the modeling folks at UT that the mayor mentioned, who are going to look at some of these particular issues. What would be reasonable if we're doing okay in a couple of weeks or in a week? What is reasonable risk that we can turn back on for the construction piece, so that we don't halt everything, but we can limit and further continue to mitigate the risk of uncontrolled spread. So we are doing that. We will be doing that, and we've had a number of staff already involved in working through some of those details.
I appreciate that, and it sounds like there's probably a lot of us, if not all of us, that are getting similar questions about this. So I hope we can help kind of guide that conversation moving forward, because I think some of it is a matter of health and safety, but we obviously want to be looking out for everyone involved. So thanks.
You bet.
All right, let's go to Director Hayden. Before we do, colleagues, 1, 2, 3. Okay, well, we got. Let's. We didn't postpone the public hearings. There are items 61, 62, and 63. 61 to be postponed to April 9th, 62 to be postponed to May 7th, and 63 to be postponed to April 9th. Is there a motion to postpone these? Motion, Councilmember Poole. Is there a second? Councilmember Alter seconds them. All in favor of postponing, please raise your hand. Those opposed, it's unanimous on the dais. Those 3 are postponed. Mayor Pro Tem, would you please take the helm, and I'll be back in just a moment, if I can. Manager?
Appreciate all the dialogue so far, and with your permission, with the council's permission, we'll dismiss Dr. Escott so he can get back to his work, and then I'm going to ask if we can have Director Hayden, Director Ortiz, and then Director Briseño go in sequence, and then we'll open it up for questions for all 3 of them at that point. Director Hayden.
Good afternoon. Thank you for the opportunity to be here this evening. Austin Public Health Department Operation Center continues to be operating within this response. That is where our subject matter experts are, which include our epidemiologists as well as our nurses. And we have our planners, and we have some medical staff that are in that space. We set up a regional call center, and Travis County Medical Association is helping us to staff that with some physicians. Some of our Austin Public Health nurses are providing assistance at that call center as well. A public health representative is always at the Emergency Operations Center when it's open. And so that allows us to ensure coordination between what's happening at the Department Operations Center as well as in our field operations and our testing sites. As Dr. Escott mentioned, we are working very closely with our partners on that testing site, and we have several Austin Public Health staff that are leading that effort from a incident command structure. Our staff are working on contact tracing as well as surveillance to ensure that as we get cases that come in, we are really looking to see if there is any connection to other cases. And at this time, we have 5 clusters that we are looking at throughout the city and determining the commonalities with those clusters. We have established a social service branch, which was started today in the Emergency Operations Center. And so that social services branch director will have the same schedule and be embedded in the Emergency Operations Center. Those representatives are Assistant Director Adrian Stirrup from Austin Public Health, and then Travis County Health and Human Services and Veteran Services has provided 2 of their executive and senior level manager staff. We have a weekly call with the task force and strike team leaders, and we're going to make sure that you all get the information which provides a description of those task force and strike forces, as well as the leads for those specific areas. All of those task force have an equity lens. We are working with the Equity Office to ensure that as we are planning and providing services and looking at services to our vulnerable population, we are considering and making sure we have an equity lens in those services. We have groups such as childcare, food access, behavioral health, and homelessness, just to name a few. So, for example, our homeless folks are on a daily call, where they are, which actually includes Vela Carmen, our interim homeless services officer, as well as Assistant City Manager Chris Shorter. And our food access folks are having weekly calls, but they're having some daily calls with food pantry providers, as well as other partners that provide food assistance, including our farmers market. Our child care folks have been working really extensively through this process. They've developed a survey which they've sent out to our healthcare providers as well as other community members. They are also providing technical assistance to our child care providers. We are working with City Legal on an agreement to have data sharing agreement with the University of Texas Medical School, because as we expand the footprint of our contract tracing and get more cases in, it will allow us to have the ability to share some data with them as they look into our operations and assist us as well. Our environmental health team are continuing to work with our restaurant vendors and provide technical assistance to them to ensure food safety so we can avoid foodborne illnesses. And just one other thing, I know a lot of you have asked questions about construction, and I know Ann could probably elaborate on this more than I can, but there is a wind down clause that we put in the orders that allows the ability to wind down the current construction. And I believe it is ending March the 27th, but Ann can probably correct me if I'm misstating that. And so I will pause for her to.
Thank you. You didn't quite misstate it. It's not in the order, but there was guidance that the mayor asked us to put out after the order was in place, and it does have that wind down period, which ends at midnight tomorrow.
Thank you. So I'm going to pass over to.
Sorry, can I have a follow-up? Where is that guidance, Ann? Is it on the COVID website?
I think it should be there. It went through PIO. If it's not there, I'll make sure it gets up there.
Okay, thanks.
So I'm going to turn it over to Juan Ortiz.
Before you do that, let me see if anybody has questions for you.
He said to let
everyone go through all three.
Oh, okay. I'm sorry. Go ahead.
Yes.
Good afternoon. I'm Juan Ortiz. I'm the Director for Homeland Security and Emergency Management with the City of Austin. We've been working to support public health since the beginning of this incident. Officially, we activated the Emergency Operations Center on March the 3rd, and we are continuing to provide support not only to public health, but to the medical system that provides services to the citizens of Austin and Travis County. We are coordinating with all of the major counties around us and also with the Council of Governments to make sure that we're sharing information, looking at all the different facets of the community. Officially, we are at level 1 of our activation, and we have declared a disaster. The president has declared the state of Texas a disaster, which makes us available for some protective measures reimbursement that would be at a 75-25%. We're working with the state of Texas to identify all our costs to ensure that if there is, to work with the state of Texas to ensure that Texas, as well as our communities, are eligible for any additional programs that may become available. At this point in time, there has not been what we call individual assistance. We hope that the administration at the national level will make that recommendation to the president. Therefore, there will be individual assistance provided to our communities as they are impacted and help them to recover from this nationwide disaster. I want to just kind of let you know that we are coordinating several of the major efforts in the community to look for any additional personal protective equipment that can be collected and made available for first responders. We have received lots of different offers for assistance, and we're coordinating to work through all of those. Every lead that we get for resources or supplies, we're working with our logistics teams. And then also we brought in the Office of Innovation from the City of Austin to look at how we can also look at fostering innovative ideas to expand not only the availability of personal protective equipment, but also expand the innovations so we can expand our capacity and the medical community as well. We took steps early on to ensure that our departments were aware of this was coming and make sure that they had their continuity of operations plan in effect, ready, and make sure that we were taking protective measures to protect the community essential services. We want to make sure that people can still call 911 and get those adequate level of services, ensure that there's power, water, those basic community lifelines that everybody requires in a community. In addition, we're working with our private sector and our vendors to see what we can do to meet the requirements of the public health authority from a social distance perspective, and then to see where we can come up with ideas of how we can ensure that there's availability of products at the grocery stores and so forth. Even in the EOC, we are doing our efforts to ensure that we harden our facility. We've taken steps. We're checking temperatures outside of the facilities. We develop that with other departments and other agencies in other communities that are looking at us to guide them and make sure that everything that we can do, just like you are doing here today, we're trying to virtualize as best as we can and expand our operation to other areas. And we want to ensure that we're meeting that social distancing as well, just like everybody else in the community.
And before Director Briceño starts, to answer the question, that document on guidance is online. It's on the main page of our austintexas.gov /COVID-19, and it's under the current orders. Director.
Council members, Veronica Briceño, Director of the Economic Development Department. As you're aware, COVID-19 has resulted in unprecedented health and economic impacts to our Austin business community and their employees. I want to talk a little bit today about what we've done so far, what we plan to do in the immediate future, and what's to come. Staff has been working diligently to lessen financial hardships and will continue to do so. Some of the actions that we have taken already include working closely with our EOC to make sure that we're getting information available to our business community. And additionally, we now have 2 staff members on staff in the EOC to answer questions directly with businesses as they call in with questions about how the orders pertain to them. We're waiving fees for our online classes for small businesses. We're working with the city and county officials. We worked with city and county officials to help Travis County receive a disaster declaration from the U.S. Small Business Administration. We're offering virtual workshops and office hours for our Heritage Grant Program. We're returning outdoor music venue permit fees to venues, and we're assisting with other fees that were assessed during in relation to South by Southwest and seeing that those can be refunded. We're meeting with Regional Economic Development Task Force, including the Greater Austin Chamber, Travis County, and Workforce Solutions, both capital area and rural. We're involved in creative restaurant, construction, tech, and manufacturing industry discussions regarding the city's COVID-19 orders. We're partnering with our service providers like BCL, EGBI, Big Austin, and People Fund to provide technical assistance to small business owners. We're working with community arts and business organizations to communicate resources that are being provided to our community. And we're also talking to the Austin Community Foundation about alignment of potential programming and partnerships. We're grateful for the action that City Council took today towards creating the Austin Economic Injury Loan Program. And in addition to these resources, we're looking at how we can redeploy current resources or acquire additional resources for Austin's businesses and their employees. For example, we're reconfiguring our staff to ensure that we're providing technical assistance as businesses are applying for federal disaster aid. And we're looking at Creative Space Assistant Program Modifications, or CSAP, to allow for arts groups that are arts individuals, artists or creatives, that have been impacted by this economic situation to apply for relief. I know housing assistance is also a priority. Housing is working on a variety of programs with existing providers. They will be providing a memo to council in the weeks to come once details are finalized. They're also providing outreach to landlords with low and moderate income renters. So as it's been mentioned today, I've been asked to lead the city's overall economic recovery efforts. This is going to include both cross-departmental efforts to address recovery, as well as a regional approach with other entities. It's important that we respond not only as a city, but as a region. And I want to be clear that we're doing this working closely with our equity office. It's important that equity is part of that framework as we're looking at economic recovery. As it was communicated to you earlier this week, this plan has 4 main goals. They include convening leadership panels to guide recovery efforts. These will be a variety of, panels including economic experts, elected officials, key administration officials, and this will guide our efforts as we move into recovery. Connecting businesses and residents to economic resources is our second goal. We're looking to connect individuals and businesses to the resources that exist in our community, our region, our state, and our federal government. The third goal is promoting and reassessing current city programs. We will conduct an inventory of all the programs that we provide as a city that can provide assistance immediately or can be repurposed to provide assistance. And finally, we will be using data and collecting new data to drive decision making. We want to make sure that our work that we have to increase funding or redirect funding is based on data. So these are the 4 goals that we will be using to move forward into this next stage of recovery. The goal of this plan is to incorporate as much input from our community leaders, from our community members, from our businesses and their employees. And in addition to that, we have been working with John Hawkinos. The Economic Development Department has been working with him in terms of identifying sources for relief and helping us in looking at economic relief. And our budget office has also been working with him looking at economic impact. So I believe he's online. John, are you part of our call?
I am.
So I'm going to turn it over to him so he can speak to you a little bit about his thoughts on where we're at as a city.
Well, thanks, Veronica, and Mayor and Council. It's great to see you all virtually, I guess. I guess doesn't it feel a little bit like we're trying to build an airplane and fly it at exactly the same time? It's crazy. Anyway, just to give you a little context, first of all, I want to say that it is awesome to see the city as focused on being as responsive as they can be, and I think Veronica and her team and other leaders in the city right now are doing a terrific job of leaning into all this, trying really, really hard to be as both responsive and forward-thinking as they can. And that's really the challenge, right? I mean, every single day we get new or better information about what resources might be out there coming from the federal government, potentially coming from other sources, and we have to try to be responsive to that and fit our local programs and our local efforts so that they don't duplicate what's coming from the feds or they provide a bridge to what's coming from the federal government. And I think that's really, as we stand here today on March 26th, kind of what it looks like we're finding is that there is going to be substantial relief coming from the federal government for small business. There is going to be, I think, substantial relief coming at least over the next 4 months or so for folks who have been laid off. There are going to be opportunities to bridge this gap. But the bridge may not get built for a matter of days, maybe a matter of weeks, could be as much as a month or two. And I think in the short run, there is a very important role that I think the city recognizes and is trying to play in helping to build the bridge, if you will. Having said that, then it will be about how do we restart the economy once we've given people this kind of foundational bridge to restart the economy on it. Of course, that is obviously largely going to be determined by really confidence that our public health situation has been taken to an acceptable level, that it's okay to come back out into the world. It's okay to go back to work. It's okay to go back to go out to eat. It's okay to go to a movie and all that. And we're just going to have to see how that plays out. I wouldn't tend to know the specifics on that, but I know if we buy fiat said magically tomorrow, hey, everything's open, I don't think the city at large is going to rush right back out to see a movie or go to a restaurant, because I think people would rightly think there's public health implications to that, which we have to be careful about. So that'll be the next challenge. And then on beyond that, and today is not the day to worry about this, except I'm already worrying about it, there are going to be budget implications for the city of Austin and for other local governments. I think it's absolutely crucial that we're doing what we're doing to build these bridges and build these transitions, but sales tax is going to take a hit. Hotel lodging tax is going to take a substantial hit. And what I'm working on right now is putting together the capacity to run a whole range of different scenarios on that, so you as decision makers have as the best information possible we can give you in as broad a context as we can make it, so that you can begin to make decisions as we move into the summer, as we move through budget season, about not only what do we have to do in the short run, but what do we have to do in the medium term and the longer term. So I have to tell you, it's an honor and a pleasure for me to be involved. I'm energized as can be. I'm excited to work with everybody at the city on this. And, with some luck, we'll do this as well as we can do it. We'll minimize the damage and position ourselves to be as successful as we can be going forward.
Thank you, Director. And with that, Mayor, I'll just remind Council and that I sent a memo out on Sunday night, March 22nd. That was a supplement to the daily email that you received. But for both the Director Hayden, Director Briceño, and Director Ortiz, they stand ready for questions. But we also have folks from HR, Finance, and many others on the phone. And so we'll just open it up for additional comments and questions at this time.
Okay. Questions from the dais. Mayor Pro Tem Garza.
I had a question about the food pantries. And just because hopefully folks are watching this and spreading news, but I had a call yesterday with the executive director of the Capital Area Food Bank, and they expressed that demand had obviously significantly risen in these last couple of days, but then yesterday it drastically declined, and the concern was maybe the stay-at-home order may have made people think that they could not go to the food bank. And so my office tried to push out information to the media to make it clear that you can still go. It's an essential business, and you can still go to the food bank or any of the distribution centers, as well as you can still volunteer at those centers as well. And so I have a separate food pantry question, but I also wanted to mention I didn't see anybody here from, I guess, APD. So is there anyone that could answer those questions in a second when I get to that?
And when we do that, could we start to interrupt? Now that we have more people coming up to the microphone, don't anybody touch the microphone? They're all positioned and they can catch you. And while we have 3 people up here, if the third person could be sitting down, I think that would be best. I'm sorry. Go ahead.
Okay. It's my understanding that in order to be a food pantry, you have to get a city permit to be able to do that. Is that right?
I can't answer that question.
Okay.
I would have to ask.
And the only reason I ask is if that is in fact true. I appreciate the broad resolution that we just passed, and I hope as part of that is that we are more lenient about that right now. So if a church wants to now set up a food pantry, they will not be fined by code or be required to close and then get a permit to open. So I wanted to ask about the permits and the fines involved in that, because in the conversation that we were actually having with the food bank, I had actually had a meeting with them before this all happened, specifically about this permitting issue that they were trying to work on through the Food Policy Board. And then because of what happened, because of all this that's happened, they said, can we talk about that later? There's more pressing things right now. So did you?
As you sometimes I have to go back in my mind and think about it. So the department is working with the Food Policy Board. And so we are being very, very flexible with the food pantries, but they're There was a conversation, as you talked about, as you spoke of, with the Food Policy Board. Our environmental health folks are a part of that team as we are looking at other type, and I'm sure that's going to come back later. So at this time, yes, there is a requirement to have a permit. But our folks will be adding that to the list of things that we need to be thinking about and considering. So yes, there is a requirement for that, but we will work with them.
Okay, sounds good. And then I don't know who to ask this to, but it was specifically, there was I've gotten lots of questions about construction, and then this was another one that rose to the top. People, the decline in people going into food distribution centers, but people we're not under a curfew. I just want to make sure we're not under a curfew. Is that right?
No.
Okay.
No curfew.
And a police officer is not going to start pulling people over simply because they're out in their cars right now. Is that right?
That's not the direct. The city manager can answer that, but that's not the directive.
Yeah, that's correct. I mean, we are not in a kind of shelter at home scenario, and we have explicit instructions both on our website and that we've given to our police department on, you have to have, and making sure that this is not a mandatory lockdown, that this asks our community to avoid non-essential outings, but additional documentation beyond regular ID requirements for transportation is not necessary to travel to essential activities or businesses. And so therefore, that should not be an issue, but if people do hear about something, we want to know those examples so we can proactively address them, but we've already been proactively communicating both through our law enforcement agencies that is not the intention of this order.
Okay, thank you.
I can also add, from the EOC perspective, we're communicating with the other surrounding communities to ensure that they are aware of what our decisions, so that we can also Can you hear me? Yes. Okay. I just wanted to add that in addition to that, the EOC is coordinated with the surrounding communities to ensure that they're aware of our position and make sure that they're aware that we will have employees come in both directions, if they're going to essential work locations, and we're getting really good cooperation from everybody around us.
Am I able to ask a question of Mr. Hawkins? Is he still on?
I'm still here, yeah. Hey.
Sorry, I can't see you, but I'm glad I can hear you. I appreciate the idea of building a bridge to a bridge that might be coming, but have you done or are you doing analysis, or is anybody on staff doing analysis on how many people are not getting a bridge right now? How many people in our community we don't anticipate under the federal bill are going to have access to unemployment or to emergency assistance? Do we have that number, and are we developing it?
Yeah, we haven't started yet, but yeah, we clearly need to take a look at that. I mean, literally, the Senate just passed the let's call it the relief package like this fairly late last night. The anticipation is the House will basically concur with that, and so got to go through it with kind of a fine-tooth comb, figure out who's covered by unemployment. Who was likely to retain their job under the provisions made for small employers, and then really who falls into that net. One of the encouraging things is that there's specific language in there that says if you're a 1099 worker, you qualify for the unemployment benefit, which, extend out around 4 months, likely should average, I'm going to say $900,000 a month based on what I know, based on $600 Fed as sort of a ballpark number for here in the state of Texas. So I think what we're going to like to find that it's going to be people who are undocumented, people who are not receiving 1099s, not on official payroll, and all that. And we're just going to have to work and try to figure out what that looks like.
And I want to start off just with my comments on this, thanking everybody that's been working on this. I mean, our city leadership has been in touch at all times. Our frontline folks from the people working on public safety to the folks at 311 call center. I know everybody is working as hard as they can on this. I think that what I've experienced in the last few days is similar to what some council offices may have experienced, which is just a huge flood of emails and calls and messages at a level that I haven't seen before, of people that are just really afraid, scared that they can't go to work and they don't know how they're going to pay for food and medicine and housing, scared that they might be forced to go to work but don't want to get sick and then get their family members sick or put people at risk, scared about whether they go to work if they're going to get in trouble for having gone to work because they don't know the rules. And I appreciate all of what we're trying to do to get people to understand and to know that we're going to get through this together. But I just, for those of us that represent communities that are overwhelmingly folks that are restaurant workers and domestic workers and construction workers and cooks and hospitality workers and communities of color and working class folks, we know that it's those communities that are most on the front line, potentially to get the virus, and then the same people that have the most trouble paying the bills. And I think we all have to stand up and refuse to choose between people disproportionately getting sick and dying and people not having the money that they need to survive. We know that tens of thousands of people in our city have already lost income. Many of them have lost jobs, and that we know that many of them aren't going to get unemployment insurance even under the best versions of this federal bill. Many of them are not going to get help. Many of them, we can't build a bridge to a bridge if that second bridge is not coming. So colleagues and mayor and manager and everybody who I know is already working so hard, I think that we still are not prepared. And I know we're working really hard, but we have to work even harder to get prepared for what is coming because, as Dr. Escott said, and as the mayor has emphasized, we cannot let people die. We cannot allow us to get to a place where we have 3,000 or 6,000 people dying in the next 5 months. And we have to save those lives and also make sure, regardless of the challenges, that everybody in the city can meet their basic needs. And we have to step into that breach because the federal government, we cannot plan that they are going to take care of the tens of thousands of people in this city who they may leave out. Whoever that is. So we have to find out who's going to get left out and find out how it is we both make sure that we don't have thousands of people dying and make sure that we don't have thousands of people that don't have the money to survive. And we can do it, but it's going to be really hard and it's going to take extraordinary measures and it's going to take planning for it now because we cannot just hope that they're going to figure it out. There are incredibly resilient people in our communities, many of whom will figure it out on their own, but with so many people all at once not having a job or not being able to work, which for many folks is going to be the right thing, we are not, everything we're doing right now does not sound like enough if we're going to have potentially tens of thousands of people who don't get help. And so we need to find a way to get every single person help. And I know we can do it, and I appreciate the work, but I just want to sound that alarm that people are scared, and they're scared for good reason, and we can help them feel better when we have a plan.
And I know that the county is taking a look at all of the social service dollars they have and deciding whether or not we can redirect social service dollars to people, making sure they have food and they have medicine over the next 2 months or 3 months. And I think that's the kind of thing we need to be taking a look at. Councilmember Tovo and then Councilmember Harper-Madison.
Thank you, Mayor, and thank you to my colleagues for your good questions and to our staff. I think this question is best directed at Director Hayden. I wondered if you could provide us with some information about new and additional resources for our neighbors who are experiencing homelessness. You certainly referred to it, and I know there's a lot of hard work going on. You mentioned daily calls with our social service providers, but if you had any level of detail to provide our community, I know that's been certainly something that we're hearing from the community about, making sure that there are the resources there from food to shelter to medical care.
Absolutely. Our homeless task force with those calls, they have also developed some strike teams. And so one of the strike teams is access to food. And so we've had a few conversations and meetings about emergency meal distributions and really working with our existing partners, because currently we have some partners that have decided at this point, for various reasons, they're not able to provide meals. And so we are looking at the existing folks that have remained in that space. And so working with our leads in the Office of Sustainability to just determine exactly how we can provide those meals 7 days a week, to be able to work with our partners to be able to do that. So if we don't want to create a new process of feeding if we don't have to, but how can we provide, whether it's meals or protective equipment, to our partners so they can stand back up their operations and be able to provide those meals. The other thing that we are doing is working very closely with them and the medical providers. And as they go through the process, and if they determine they have a person that needs to be quarantined, we're able to put them in one of the locations for quarantine, and then being able to provide them the food and necessities that they need in that space. The other thing that we're looking at from a food access perspective is, it kind of goes back to Councilmember Cassar concern, is that looking at how we as a community can mobilize and do emergency meal distribution outside of the homeless population, but in neighborhoods where we know that people are going to be, really hit the hardest. Looking at our neighborhoods where we know before COVID-19 are areas where we have pockets of poverty, pockets of folks that may have been uninsured before this hit, and being able to address some of those already pre-existing social determinants of health. And so looking at emergency food distribution boxes as well to be able to provide that. And then the other thing is as we are looking at our social service contracts, having conversations with the actual vendors and talking with them about, how they can modify the services that they are providing to be able to provide a little bit more flexibility to them as far as performance. And that way they can be able to work with the clients that they need assistance with. The other thing that we have been having several discussions about is our experts have really teed in to help us to provide us some insights on additional federal dollars that are going to come down, as well as just providing us their expertise about what they've seen nationally in other areas. And so between all of those conversations and those meetings, we will be, moving forward with some additional actions and bringing some things forward to council that are in alignment with the resolution that you just passed.
Director Hayden, if I could, thank you for sorry. We're all adjusting to the new workplace. Thank you for discussing the mobilization of food within the neighborhoods, the emergency food mobilization that you just addressed. That seems like a very important initiative. And just as a reminder to the public, that AISD is doing that for students who are enrolled in AISD, not just students, but also their parents or caregivers, and they have information about that on the AISD website. I understand too that you're working on providing sanitation, hand washing, and other supplies to individuals who are experiencing homelessness, and that's working either with making restrooms available at some of our existing city facilities and getting hand washing or hand sanitation items out. Is that correct?
That is correct. Our library and as well as our parks and recreation Department, as you may know, they have left some of their park and recreation sites open so our homeless community can go in and take a shower and address their hygiene needs. Some of our libraries have remained open as well. We have put out some porta potties where folks can, access those. We have mobilized some hand washing stations and also ensured that with our ballot bag program that we are continuing to make sure that we are picking up and disposing of trash. The other thing is throughout the city in our parks location with our outdoor restrooms, those outdoor restrooms have remained open during this time, and our park staff have serviced those a little more because we want to make sure that they want to make sure that they are keeping everything clean. So we have several efforts that we have to ensure folks have the ability to shower, use the restroom, and wash their hands. And we are expanding, and so we intend to expand in that space.
Thank you so very much.
Does anybody, Councilmember Poole and then Councilmember Alter, anybody else on the screen have a question? And Councilmember Flanagan.
Director Hayden, thanks for your report today. You mentioned a little bit ago something about clusters of infection that you've identified around the city. Is that information available to us?
Yes. Maybe you and I can talk offline about exactly what you would like to know.
What I'd like to know is if there's any particular issues in my district specifically. So yeah, I'd be happy to talk with you offline. That'd be great. Recognizing that I'm not looking for names or anything. I just kind of like to know a geographic location.
Absolutely.
Recognizing HIPAA violations and that sort of thing.
Yes, we just recently got the confirmation of 3 of those clusters, and so we're going to be talking with our staff about to just go ahead and map that. That way, it's available for the public to be able to have that information. So we are working on that.
That's great. The mapping should be public. And then the other question I had an email from a friend who has a friend working at one of the hospitals, and they have a lot of contract nurses who have been let go. And so they don't, and this goes to some of the concerns that we've raised already today and passed in a couple of the resolutions to provide support for people. Evidently, there's maybe a lack of accurate information being handed out. So some of those people who are newly unemployed are not happy about it, and they're directing their anger and blame toward the City Council and Travis County. So I think it's would be really helpful for us to get as much information out to the various hospitals to make sure that they are also, if indeed they are letting contract employees go, which I, just personally for me, why? Because I would think that our healthcare workers would be the ones that are most needed at this time. So I frankly don't understand why they would be being let go. And then also, so there's that. And then one other thing relating to the hospitals, is there a way that is there something that the hospitals can do to reconfigure, to free up, to restructure and free up more of their beds to be ICU beds?
Okay, we can follow up with our team that we have our conversation with. So yes, absolutely, we can follow up with them.
I bet they're already thinking about that. And then as far as letting go the healthcare workers, the nurses at the hospitals, that is also a concern. See if we can find out some more about that. Okay.
Absolutely.
Thanks so much.
Mayor Adler had actually called Councilmember Harper Madison after Councilmember Tovo, so I'm going to go ahead and recognize Councilmember Harper Madison.
Thank you. I appreciate it. I think a good segue will be to pick up where Councilmember Poole left off. I sort of wrote the same thing when I put 5 clusters. I basically was asking for the same information. If we could get that by zip code, or by district. I think something about that could be helpful for the information that we disseminate with our constituents. But other than that, I wanted to ask, I think this will be for Mrs. Breseño. I can't see the chamber, so if you're up, I don't know.
Yes, I'm at the podium.
Okay, so the question about, somebody brought it up earlier about getting paid under the table. So my question is about employers who aren't, sort of paying their employees above board. If they are able to get access to some sort of relief program, but they have, sort of hourly wage employees that they aren't offering any benefits to, I'm concerned about that. I just want to know if that's a point of concern for y'all, and if we're prepared to reconcile that problem.
Absolutely. I think that is a concern. I don't know what the right solution is, but I do think that that's something we're going to need to address and find some resources for the employees in those situations. So happy to work more on that.
Yeah, that'd be great. I'd love to follow up with you on that sooner than later.
That'd be great.
I'm sorry.
Can I say something on that? This is John Hopkins. I think in the federal stuff anyway, we could mimic this. You have to document that you've actually made payroll, paid payroll taxes and all that. And so if people are paying folks under the table, that it would be a legitimate basis of asking for relief from the federal government.
I think I heard most of what you said.
Sorry about that.
You know what? At the risk of sort of belaboring the point, I think the point you were trying to make was that most employers have to qualify for that federal subsidy.
Yeah.
Yes, this is Ann. And anything that the government is going to pay for a benefit program, they would have to demonstrate that they had actually paid properly and all that kind of. So that would be part of our program.
Okay, I appreciate that. So then the other thing I was going to ask was about, I'm sorry, I wrote down several things. Hygiene access. So I know we had the conversation. I'm sorry, Director Hayden, I should have asked you this when you were up. I know we had the conversation about emergency food delivery and addressing food insecurity in neighborhoods, but it's also been brought to our attention on multiple occasions that people are having issues with access to hygiene products, specifically feminine hygiene, incontinence products, diapers, those sorts of products as well. Just wondering, do we have a system in place to where we know what people need, or are we able to somehow meet the need in addition to the food need? I don't know if it happens simultaneously or independent of one another, but just wondering where we're at there.
That actually is happening within that process, because the food bank, for example, does receive those products, but also Austin Public Health at the neighborhood centers. We have some of our Parks and Rec sites, as well as a few of our libraries that started a pilot this year. And so we have those products available through several of the libraries and a few of the park sites, but then all of our neighborhood centers. So our neighborhood centers are currently open and are providing, we're not open with people just to walk in from the public, but what we are working on, what we have put in place is that we started on Monday is a food delivery process where folks will call us at the neighborhood center, and then our staff will put together the food order. And because we have those products, we are able to put that in with the food order.
Do you know how people are getting this information? Like, how do they know to call the neighborhood centers and to be able to ask for a custom-made food box and to get access to products? How are we getting that out?
Well, we have been putting that out in the information, but we'll go back and double check it with our PIO folks to make sure it is updated to have that specific information on there.
Yeah, that'd be great. Including a list of the neighborhood centers and all that. And then, No, that was for volunteers. Yeah, I think that. Oh no, my last question was about somebody asked. So alongside a church, a volunteer organization, a group of volunteers are packing food and other products and then delivering them. They wanted to know how our current set of orders affect those volunteer initiatives.
So we reached out to, we have a couple of people. One of our task force is a faith-based task force, and so we've had some folks to reach out to a group of people and have that conversation. And we understand that there are several churches that are providing that food delivery as well as keeping their pantries open. And so they are able to do that. And we've shared that with them, and we provide some technical assistance to them about how they would be able to do it. And so as we get those requests, we do need to go ahead and update the website to include that information. But that is something that they can continue to do. It is very helpful. The Office of Sustainability really tries to track everyone in this community in Austin and Travis County that are doing some type of food efforts.
Also, let me add also, we have a representative from the EOC, from the volunteer organizations active in disaster, and also from the Red Cross and from the Austin Disaster Relief Network. And they're helping us make sure that we are becoming aware of those local grassroots efforts to pass food, as well as to collect the personal protective equipment and other programs that are taking place in our community by themselves. We're sharing information. We also are letting them know what the needs are out in the community as we become aware. And so a lot of that is being coordinated through those primary agencies that we have in our community. That's the Austin Disaster Relief Network, the American Red Cross, and the volunteer organizations active in disaster.
Okay, were those all your questions?
More or less. I was just going to say, so for the folks that are on the ground that are already doing the work, if their questions are, can we continue to do the work? I think what I just heard was we get them connected to the disaster relief folks, the Red Cross folks, and active in disaster. Is that
the VOAD? Correct. It's called VOAD, and a lot of the the VOAD is actually made up of different organizations throughout the community. So if they get the word to us in the EOC, then we will make sure that we share them with all of the other agencies so that we all become aware of what everybody's doing.
That's helpful. Thank you.
Okay, Councilmember Alter.
Thank you. It would be great if you could share us that information in a written form. That would be appropriate to share, because we're getting a lot of the requests that Councilmember Harper Madison had suggested of people wanting to help. I first of all want to just thank all the staff for the tremendous amount of work that you're doing and the amount of time and the sacrifice that you're doing to keep the city moving. So thank you very much. I wanted to first just flag something both for my colleagues and for, I guess, the PIO staff. My staff has been working on broadband and digital access stuff for about a year, and so when this all hit, we've started working pretty closely with the city's digital equity team, the ISPs, and the community members on identifying the digital access needs and available resources around Austin. Many ISPs are offering programs for those now at home, and businesses and community groups are looking to identify access to devices, and they're pretty close to having a final resource together that will share some of that information. So I'd like to just make sure that we can get that up on the COVID-19 website, and I'll try and get it out as well to colleagues maybe on the message board so you can help share it in your newsletters. I wanted to ask about our City of Austin employees, and I've been hearing some concerns about folks on two fronts. One is that there's not enough childcare, and that's causing people to have to use sick leave and vacation time. Sometimes this is for essential employees, and there needs to be a way to address that. They may not be able to come in for 8-hour days and whatnot. And then the second part of that is that we're hearing reports of employees who could work at home but are being deemed essential, and they do not necessarily agree with that interpretation. So, Ms. Hayes, if you could maybe talk to how we're handling and what our next steps are on that. I know that it's not easy to switch, 16,000 people quickly and move forward, so there may be things we're ironing out. Can you speak to how we're addressing those situations?
Absolutely. Joya Hayes, HR Director. I'll begin with a child care concern. We currently have 3 locations, one south, one north, one central, that will allow employees who are essential. This is not just for all employees, but those who are essential, who are required to come into the workplace. We have facilities that are available. As of now, those facilities are not full. We received some communication from Councilmember Flanagan's office that we try to create better ways to ensure that this communication is getting to the employees that are essential. We have a daily call with our HR managers from across the city. We've communicated that we need to make sure that this is announced and communicated to all field employees and all essential employees so they are aware of it. Our PART department has been excellent in not only providing child care space, but also providing the opportunity to assist students who may have special needs. And they are prepared to add an additional space if the numbers increase in the current existing spaces that we have. So we've tried to address that issue as best as we can. I will clarify, though, that as it relates to child care, because of laws, our PART spaces can only accommodate children over the age of 5 years old. And so children who are between 0 and 4 cannot participate in those procedures. And so what we've done is work with our health department and with AISD and ACC to establish a list of spaces who are accepting children under the age of 5 and provided that on our city intranet site. So employees who have those children at those ages have an opportunity to acquire some additional support. As you are aware, we have a child system stipend that we already provide to employees who have children who fall within a threshold. We're currently evaluating that to see if there is some flexibility for additional funds during this period of time to support those parents who have young children that may need support through the daycares. We've also, through many different sources, worked with YMCA to provide information about their resources and make that available to our employees. And so we are doing our best to assist in those spaces. In all honesty, as we transition so many employees home, we are recognizing that our parents are being challenged with how to function, work, educate, and babysit their children. And so we're also attempting to allow flexibility through the departments so employees can work early morning, take a break midday, maybe come back in evening hours when they have additional support, or providing them the opportunity to create as much of a flexible schedule to adjust to the needs of having to be home with their children. In the 2 weeks that we have been in this process, we are working directly with departments to figure out ways, innovative ways, to allow employees who typically don't have jobs that can be done at home, the opportunity to be at home. Really excited that our organizational development team has developed over 3 weeks worth of free training that people can access, not only through their home computer, but also in the outer areas. We have some access to computers that employees can go to that provide them safe distancing to allow them to be closer to home, but also have the opportunity to participate in online training. And we're looking to add hundreds of classes to the online training process as early as next week. So employees who are traditionally not able to stay home to do their work have that flexibility. And so we're trying to slowly but surely add as many people in our employee population to those who can work from home to address their child care needs. And so that is the current strategies as it relates to child care. If any of you all are receiving calls from employees who are concerned about child care, if you'll refer them to us, we are working directly with AFSCME and all of our sworn unions. We speak on a weekly basis. AFSCME, I talk to a little bit more often to address the needs of employees, and we're able to make any adjustments we need to meet the unique needs of our employee population, and we're willing to do so as it relates to the child care.
Before you go to the second part, if I just might add, I appreciate all the work, and I understand it's a mammoth task. And I appreciate some of the things that you're talking about in the flexibilities for those who are staying home, but some of them are essential. They just aren't essential to be on the job. And many folks may not be comfortable putting their kids in daycare when they're supposed to be social distancing. The issue is that they have to use the parental leave banks or leave without pay to address the child care during the school day, or at least that's how they're feeling that they have to handle things.
So thank you for that clarification. We have made it clear to all employees that there is no usage of leave without pay as a result of child care issues. We are instructing those departments that they have employees who are essential because their work can only be done from the workspace, to create innovative ways to allow those employees to go home and work and either at minimum do training. And then we're also working with our CTM department to identify the technology needed to support those employees from working from home. So any communication relative to employees being forced to use leave without pay is not accurate, and we've attempted to address that in our communications to the departments. I will share with you, there are some employees who are ill because of things other than COVID. They have flu, they've got other illnesses, upper respiratory infections, those types of things in those spaces. If those employees have not saved their leave and they are sick, it is the same scenario we would find in any other day, in any other work day. They have to use their sick leave in order to accommodate that. What we have, though, is a sick leave pool. So employees who run out of sick leave and they are actually sick with something that is unrelated to COVID, we have a pool from which they can use. We also have a catastrophic pool. And so we have attempted to address those employees who may have limited sick leave. I think it's also important to tell you that effective next week, the Family First Corona Response Act will be in place, and that will address many of the issues we're continuing to hear relative to how we move forward. In that act, employees who cannot telework, who cannot work from home or come to work as it relates to 6 different criteria related to COVID and childcare, they will receive 80 hours of time to address that. In addition to that, the government has also changed the criteria for the Family Medical Leave Act. That was also a part of that act, which allow parents who are uncomfortable working from home with their children, uncomfortable putting their children in daycare, they can have up to 12 weeks of leave to allow them the opportunity to stay home with their children. Now, with that FMLA change, what will take place is that employees will have the first 2 weeks of time. They can either go into their own current leave and use it for that. And the remaining 10 weeks, the government requires us to pay 1/3 of their salary to them. And employees can utilize their current leave banks to supplement the rest. And so there are other programs that are coming as early as Wednesday of next week that allow employees under those circumstances the opportunity to make the choice and qualify for FMLA to address those concerns.
So I think that's great information, and we should definitely get all that out to our employees. I'm just concerned about how this is being implemented across departments, and I think that it'd be great if we were able to have some kind of hotline or some different ways of making sure that the people know who to address these issues to, and as one department learns different methods that they can do it. I think there are employees who are at home, they're not expected to be at work, but they need to do their work, and they're using the sick leave and the paid leave because they can't manage the child care any other way. And I don't know what the solution is. I'm not sure that I fully heard that solution in what you're saying, and so I just want to push you to keep thinking about that and keep working with AFSCME and our unions on that. I will just throw out a couple other ideas because I've already spoken for a while. I'd love to see us providing materials to neighborhoods on emergency response and how they can be helpful in their neighborhoods with some like ready-made tools that they could implement. I really applaud the way that we've handled a lot of our communications, but I think that what I'm hearing from folks is they want to hear more regularly from the city, and obviously we'll step up what we're doing. But if there's opportunities to post to Nextdoor regularly, or for people to sign up for a daily email for the latest news from the city, even if it's just a bunch of links, that would be helpful. This has come up a little bit, is we really need to get clarity on where people need to go if they want to offer to help, or how they can also help by giving to various places. Love to see information about how people need to handle packages that are coming into their home. We have a lot of folks going and saying, well, I'm going to deliver to a senior, but if they go and deliver packages to seniors that are contaminated, that's problematic, and so we need some guidance out there on that. And then if we could speak to, if someone could speak to 311 and what their role is in this process, and what kind of questions we should be directing to 311, and what their kind of potential ability is to interpret the stay-in-place order, I would appreciate that. So really just the last one needs to be answered. The other ones were more.
Okay, let me see if I can address some of them. So a great place for information is to go to the City of Austin website, austintexas.gov/COVID-19, and we will make sure to have some more specific information to address the questions that you brought forward. We'll have information in there about how people can help out. We have several different, like I mentioned earlier, different volunteer organizations that are helping us to kind of navigate or filter those offers of assistance from a volunteer standpoint. And we also have we're partnered with the Office of Innovation to look at those outside of the box ideas where we can expand capacity or find other sources of personal protective equipment or other items of like of sort. And then also the role for 311, actually, that's the best place for people, if they have a question, they can call 311. 311 is working with public health and the EOC to filter those specific COVID-19 questions, and then based on the type of question, they may get referred to public health specifically, where someone can call them back. Correct? So if anybody has a specific question on whether there's a city service that is being affected, or they have just a question in general from what's going on from a COVID-19 perspective, the 311 is available, and then there's also a specific number that's available for those areas outside of the city. But I'm sorry, I'm drawing a blank on that one.
If someone wants to know if something is essential and they call 311, what happens?
Well, if somebody wants to know if they're essential from their employer perspective, not a City of Austin employee, is that what the question is?
Not a City of Austin employee, but somebody, we've heard folks who are concerned that they're being told that they're essential, and so they have to go into work outside of the home, and they're afraid to do that, but they don't know where to go to understand things. And then we also have businesses who are trying to figure out, is my business fall under the category of essential so that I'm complying with the order?
Councilmember, this is an ongoing discussion. I mean, when the orders came out, we were working with our communications team through the Joint Information Center at the EOC, giving 311 as much guidance as we could at that point. But we continue to work with our legal staff on any additional questions that we get, so we can best equip our 311 staff to ensure that they can provide that clarity. But what is helpful is when we get more questions, we'll be able to respond to those questions to know what themes are generated from what concerns or uncertainties or clarifications that need to be addressed by our staff. So this is ongoing. We know that we appreciate some of the patience that this community is requiring, but we have equipped our 311 staff with the information we have, and we continue to get additional feedback with some of the questions that they raise.
Thank you. I think 301 is a really valuable resource, and just kind of tie this back with my other comments about the communications. I think folks are looking also for proactive communications from the city in ways that are empowering in different ways. And I'm happy to have a conversation with PIOs or whatever on that. Really, again, Dr. also appreciate your work on this and just trying to think about how we're iterating through this process and how we can continue to improve the communications and the leverages for that.
And I'll just use this moment to continue to encourage council members to push information out that we are providing. And so you have incredible networks and resources within your constituencies, within your districts. And the more that we can get you what you need to get that information out there, let us know. We give you daily emails. You have the website, but if there are other ways that we can package that would be helpful for you, please communicate that to us, because we all want to make sure that you can use your networks to get good, valuable information out to our community. Joy, did you want to add something else?
Just wanted to clarify that we do have an email address that any employee can submit to us asking questions. It's on our intranet site, and so all the employees have that information. We've received many emails on a day-to-day basis, but there is an avenue in which employees can submit information directly to HRD to get their questions answered.
I had Jimmy next, and then Councilmember Kitchen.
Thank you, Mayor Pro Tem. Just a quick few things, because there's been a lot of great questions, and thank everybody for your commentary. I think we can hopefully move through this last part quickly. I would say on the permits question on pop-up food banks, and I think there are questions about what are the safety precautions related to collecting and distributing food, much like Councilmember Alter mentioned with people who are delivering food. So I wouldn't want to exempt them from city review, although we're not looking, I wouldn't think, to put people through a laborious process. So we want to make sure we're dotting all the I's and crossing all the T's. I want to thank Veronica Briseno and her staff there. We've done a lot of work with her of our item today. A few things that are covered there, but I just want to highlight the regional economic response that I know that our staff is starting to talk with the staffs of other jurisdictions, ones that are overlapping, like Travis and Williamson County, which was great to see them at the press conference earlier this week, but also our neighboring jurisdictions. I've spoken with Commissioner Trevelyan and Commissioner Cook on the Williamson County side about what the county is exploring as it relates to these economic concerns. Obviously, we have a lot of shared constituents, and many of our most vulnerable residents are our shared constituents with the counties, and so I hope that they are also exploring these same areas and stepping up from their budgets to get this stuff done. One of the other items is partnering with third parties for administration. My hope is that staff is not trying to build all brand new capacity. If there are outside groups who are built to reach minority-owned business, underserved businesses, small businesses, and they already have situations set up like People Fund, and there are others, and I know staff has already started those conversations, and so I just wanted to note that and thank again staff for that. Anything that we get into our office, we're forwarding to Austin Public Health and to staff. For example, we had a local manufacturer contact us who may have some ability to provide emergency facility for medical equipment manufacturing, and so we forwarded that to staff as well. We had a business contact us who wanted to set up a pop-up drive-through testing facility, and we connected them to Austin Public Health, who already had a location for it, and so we were able to facilitate that. And I hope all of our offices are doing very similar kind of connecting and convening. I feel like that is really our most powerful tool. I'm doing a partnership project with Representative Busey in far northwest Austin, Cedar Park and Leander, to do direct outreach to seniors. We're trying to get a phone call to every senior in our overlaid areas, and I know Councilmember Kitchen and I had talked about that, and Representative Goodwin apparently is starting up a similar effort. That's really important, I think, in terms of doing communications for us. I would, like I said earlier, support any special called meetings that we need to do in order to expedite the work. There are a lot of fast-moving things happening at the federal level and other areas, and private sector work that's hopefully coming in. So consider me available to convene at a moment's notice. On the cluster data question, I'm kind of ambivalent about that, because I would also, if we started outlining cases by zip code, I would hate for people who are in the next zip code, if the case number is low, feel a false sense of security and start doing, more groups and parties and things? I don't know. I think it's a complicated question. And it kind of speaks to the challenge that the mayor and the county judge have in making these decisions. As the mayor said earlier, it is complicated. It's always a choice between two bad options. But the one question I do have for staff, what conversations have been had with CATCOG about doing emergency messages to cell phones or other types of direct communication?
We are working with the CAPCOG Council of Government, specifically with the Office of Homeland Security within the Council of Governments. They have been in our EOC. They're working us on to expand some of the tools that we have. We use a tool called WebEOC. We are at this point in time, we have not identified a need to have to utilize the One Central Texas tool, the regional notification system. Most of the notifications that we're doing, in other words, the word is already out there. We're using a lot of social tools to get the information out. So at this point in time, we have not had a need to utilize that tool. But it's something that we would look into the future, see if there's a need where we can use it.
And Councilmember, thanks for bringing that up. I mean, that's something that certainly the discussions are happening and is on the table. But as you know, we have to be judicious in how we use that. And at this point, the advice of our experts and our public safety officials has been not to. That said, that may change tonight or tomorrow. So we'll continue to evaluate that on an ongoing basis.
Thank you, Spencer. To the extent that it matters, I would support being a little more aggressive, but I understand that the decisions are hard, and I think that you all are doing as good a job as can be done with these unprecedented conditions.
Thank you, Councilmember Kitchen. And just a quick time check, are there any other council members that have questions? Councilmember Alter. Okay, go ahead, Councilmember Kitchen.
Okay, I'll be succinct. So I have three things or three subject areas. First, let me just reiterate, as Councilmember Flanagan mentioned, and my office is working on outreach well check calls to seniors, and I will post information on the message board about how we're doing that. So in case anyone else is interested in that, and thank you, Councilmember Flanagan, for sharing how your office is working with Representative Busey on that. So I'll do that in case other people want to use that approach. The second thing I wanted to just ask about was specifically, and I'm not sure who would be answering this question, but we had received requests and understand that there are requests for materials for EMS. And I had forwarded this information on, but I never got an answer on whether or not this had happened. And these were things like thermometers and IV medication pumps, some other kinds of medical equipment. And this was a request for the city to purchase these items. So how can I follow up to find out if I understand that this request was sent on to the EOC logistics team, but I don't know whatever happened with it. So,
if I can, we can talk after, and if you give me the details, I'll follow up and look into it and give you a response.
Okay, thank you. So, I also want to say that I also want to follow up on some of the questions around our employees, our ASME employees, and leave without pay. So it's just two follow-up questions for you. I'm very concerned that our employees not have to use their sick leave or vacation leave or leave without pay. So I'm not sure if I heard something that you said earlier. So my question is, are there any circumstances under which they're required to use sick leave or leave without pay?
Yes, if an employee is ill and they cannot come to work and they cannot telework and their illness is not related to COVID, then they are required to use their sick leave as they would in any other space.
Okay.
If they run out of leave, we have sick leave pools that they can come and work in. So in those spaces, they would be required to use their personal sick leave.
Okay. So I'm hoping in that circumstance that we are taking a more liberal view of that. Since we don't have testing, we don't know in some circumstances whether someone's illness is related to COVID-19 or not, if they haven't been tested.
So if they go to the hospital, and the protocol requires employees, if they want to get testing, to go to their doctor. If the doctor has deemed that a COVID test would be necessary, or they believe that it is COVID related, then that is when we trigger treating that employee differently. And so it is not about you having to take the test. It's about you not being in the workplace sick, which is our number one priority, and ensuring through your medical provider that that illness is not a threat to other employees. And so if an employee goes to their doctor and they say you've got an upper respiratory infection, your fever will go away with antibiotics, you can go back to work the next day, you come back to work. I think the challenge that we have is equity across the board. We are not closed. We are still working. And so employees are expected to work. And if we can create a space where they can work from home, or work from someplace else, or do something that allows them. We have some employees who had a fever the first day. They're still quarantined, but they're telecommuting. And so there shouldn't be any space where they can use their time. If we begin to just make a decision to give employees admin leave just as a general practice, then we're creating some issues relative to equity, because another employee could have the flu and know it, and they have to use their time, but another employee may be unknown, and so they wouldn't. We've also reached out to other cities in Texas to determine how everybody else is handling it. And for cities who attempted that, it created other equity issues that they're now trying to deal with. So we're respectful of the unknown right now, but we're creating as many spaces as we can to allow that employee to work and to heal without creating an undue equity issue of saying to one person, because you're a parent and you're having concerns, versus an employee who doesn't, or any of the other types of issues, that we treat them differently. But we have been very open, Councilmember Kitchen. If there are unique circumstances and issues, the department and or the employee can call us, and we will work through those issues. And I can assure you, up until this point, we have not asked an employee with any COVID-related or any concern of COVID-related issue to go into a leave without pay status at all.
Well, I'm also concerned about them having to use sick leave for childcare. I'll just repeat what Councilmember Alter. She asked a series of questions, and I have the same kind of concerns that she raised, and I have concerns that we are acting the same way across all departments, and I also think that we all need to err on the side of the employee, and I don't think. Because of the state of testing that's going on right now, there are circumstances where we won't know if it's COVID related or not. So I'm just asking you to please, and I know you're saying that you are, but I would rather in this time period err on the side of the employee and not require the use of leave. So that's all the questions I have right now.
Councilmember Alter.
Thank you. This is a little bit along the same lines. So I appreciate the comments about, if people are sick. But my understanding is that the employees have been directed to use leave without pay and sick leave. And if that was a mistake because certain departments were trying to implement this and didn't have correct direction, then we may need to rectify that for some of those people who did have to proceed that way, who needed to do that because they were dealing with child care issues, trying to work at home. So I'd like to make sure that we take care of that. The other question I have is for Mr. Cronk. Is there a reason we're not already using an emergency closure setup? And then that way we could classify as essential all those who are essential and let people who need to be home without as much complication.
Councilmember, this situation that we're in right now is not like a weather event where we have had emergency closures. this is a situation where we can still operate government in a transparent way, and to the degree that we can, by using other creative alternatives, by having people work at home and still adhere to the orders that have been issued. We want to make sure that we can keep government running as long as we can, because as you heard from Dr. Escott, this could be months, this could be years until we have a determination of how this might play out. And so we are making decisions that are in the best interests of our long-term awareness of what this unique situation entails, and just an emergency closure would not have accomplished that, because we can still function as a government entity in this environment. And so we know it's a little bit of a challenge from an HR perspective, and I really respect the hard work that Director Hayes has been given to this environment, but we need to keep evolving how we think about this, because we know it's going to be a marathon, not a sprint. So there were discussions early on about what methods we would pursue, but it was very clear to me that I wasn't going to go in the direction of emergency closure because we needed to keep government operating.
So I just would ask Mr. Kronk if you could try to resolve what we're hearing from folks, is that they are having to use their leave in order to take care of their children and find as many mechanisms as possible to address that. I understand it's not an easy problem, but it's not going to be sustainable for people.
I would just add, we have addressed every individual issue we've received from council members, from our individual email account. And so I will encourage you, if you're hearing, I think the issue last week that many of you got the same information on was addressed within a 24-hour period, and it was some misinformation. And so I would encourage anyone, if you have any employee who's reaching out to you saying that they've been asked to use personal leave, if you refer them to us, we will definitely take care of it immediately. And we have reached out to the departments to address that, to ensure that it doesn't happen anymore.
Okay, and if you could just make a point of checking in again with AFSCME on it and making sure that you've addressed those particular cases and they feel like you have taken all the steps, I'd appreciate it.
Absolutely. And for my own sake, I checked with her yesterday knowing we would have council today. So unless something's come up today, we are very much working together.
And I'm hearing it from not just directly from them, but also from employees.
Sure. And send them directly to us. We'll be happy to take care of it.
I know that AFSCME is a clear interlocutor you can work with.
Got it.
Thank you.
Councilmember Renteria and then Councilmember Tovo.
Yes, a lot of my calls and emails had to be with construction. There are some families that are saying, my husband still have to go and work on a construction site, and I need some more clarification. What is essential, and what is? I know that you're saying affordable housing might be one of those, but are we also allowing these companies that are building and they maybe have they're required to only build 1 or 2 affordable units at 80% MFI. What's the definition of affordable housing to the department?
So I think of all the things that we've done some things that have worked really well, and we've done some things that we have not done as well. And I think that there's a lot of confusion at this point and ambiguity with respect to construction. There are people that are meeting on that right now to try and give to the city greater understanding. We've gone back to the health officer, public health officer, and the health department to help fashion the attorneys. We knew when we were issuing the rules that we were probably going before we had figured it out really well, and the question came up as to whether or not we wanted to wait a day or two until we could really nail it down, and the decision was made that we couldn't afford to wait a day or two, and that we would have to work as fast as we could to figure this out. So we had to get the boards out, but there are people working on that right now. There's going to be greater definition that comes out. There are a lot of fact patterns. You know, we've all been getting them here. We've all been getting the same emails. There are 1,000 different fact patterns that people are saying, well, what about me, and how does that rule apply to me? The city attorney is working through those and trying to help us fashion a rule. And frankly, it's not something we do by ourselves. We're doing it in conjunction with Travis County so that we can get a common rule and a common statement on that. I understand the frustration and I understand the ambiguity that's taking place. We are working as hard and as fast as we can to try to bring some greater certainty. But if you listen to the public health officer when he spoke, what he said today was, we're going to know a lot more in 5 days. And what he said was that he wanted us, and it's his request, to err on the side of limiting the amount of physical interactions that we have. He said we're going to know more because we can monitor how the community does over the next 5 days, 6 days. When you look back 5, 6 days ago, it seems like an entirely different world. It was just over a couple weeks that we closed South by Southwest. The world has changed. So I think that at this point we're asking everybody to be as patient as we can. We understand the magnitude of the issues involved, both for people that are trying to construct and people that are working to construct. And I think that the best we can say at this point is we are living with this issue every moment of the day and trying to come up with something that will work better than where we are right now.
And I also hope that when y'all do look into that, there are also individual construction workers that just do one or have one or two persons that work with them, and see how that would be affected also.
And we've asked the modeler to see if she could help us model what it would happen with those the lines on that curve if we were to open up some of the restrictions that we have, and hope that she's offered to help us with that, so we're taking advantage of that from her. But the most important thing right now, I think, is to focus an entire community on getting to decrease physical interactions to 90%. I mean, I understand all the other conversations we're having in the city, but the single conversation every one of us should be having right now is how do we save 5,000 lives in our city? How do we save 5,000 people that might otherwise die in our city between now and the end of August? That's really what we need to be focusing on.
Thank you.
Thank you. Yeah, but why don't you take us out?
Councilmember Tovo, I think you said you had one last question.
I do, and I don't know if our staff want to address this, but I'll just point to our COVID-19 website that the City of Austin also has a section under community resources for mental health services. We've had a huge amount of information discussed today, and that's not an area that we touched on, but there are resources. I mean, this is obviously a terribly stressful period for so many in our community, many of whom are undergoing really significant financial challenges, potentially health challenges. And so I just wanted to call the public's attention to that section about Integral Care's various programs, including the 24/7 crisis helpline. And I know for students within AISD, they also have access to telemedicine as well as a mental teletherapy services through the mental health partner. And so those resources, there's more information about those resources on the City of Austin's COVID-19 website. I just wanted to call the public's attention to it. So thank you again to all of our staff for their just ongoing work, and Mayor for your leadership.
City Manager?
As we conclude today's presentation, I did want to just take a moment to acknowledge and appreciate all the incredible work that our city staff is doing. I mean, we have true public servants that are giving their daily efforts, giving up family time, giving up time that they could be spending doing other things because they care so much about our community, because they care so much about our city. And so I just really look around the room here, know that there's many others listening in, but everyone is acknowledging and appreciating the incredible work that you have been putting into this effort. So thank you. I also want to thank the mayor and his work with the judge. I think the collaboration between our city and county has been stronger than ever, and that shows. It's really critical that we have a united front as a region as we approach this challenge, and the support that we're getting from our council. So thanks to all of you for your continued direction and guidance and support as we move forward. Thank you.
I'll just echo thanks to all the staff as we navigate this this new reality of ours, and thank you for all your hard work. And it was great to see all my colleagues' faces, both on the screen and in person. And if there is no objection, we have no further items, so we are adjourned at 7:23.
What? It's okay. Never mind. I'll ask offline.
February morn, East Texas baby girl was born. I prayed for her soul to sing a righteous song. Well, and when my head grows cold, Lord, keep her in a light that's strong. Mama said